Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hello, my friend. How are you? My name is Joa Rivas, and I am the host of this podcast, Back into Alignment. And I am excited to have been able to create this space 4 years ago to share ideas and solutions for those that are experiencing back pain, neck pain, osteoarthritis, sciatica, stenosis, all these issues related to the spine. That's why it's called Back into Alignment. Not only that, we know that when we're not aligned with our purpose and our core values, we lose our balance. So it's also important to know that as long as you are in alignment with your soul journey, you are going to be in flow and you're going to be just vibrating and loving life. And that's what I love to do here. I love to bring doctors and healthcare professionals that are vibrating on a high frequency. I am excited also to share with you my journey of how I heal my scoliosis, and now I'm healing my osteoarthritis and my herniated disc and slip disc. It's been a journey and it's been very interesting. In 2015, I created the PSP Posture School Program. It's a program that I apply all the yoga, Pilates, and all the therapies that I have been practicing. I am a yoga and Pilates teacher, and I put together this program as a way to support my community because I keep hearing people with the same issues about the posture, especially now after the pandemic. We are remotely working more than before, and this is affecting our neck, bringing our forehead posture and affecting our spine and even our brain function, having difficulty to concentrate and to perform at work. There is a ultimate connector between our brain and our body, our spinal cord, and this has been ignored in the workplace. Bringing wellness to the workplace is my mission, and I really love to support my community by having the Posture School program, which is a program of 16 weeks. 16 weeks is about 4 months of program where you will navigate into all the practices, starting with Tai Chi, yoga, and Pilates. We also do learning on core strength, core stability. We learn about breath work and even how to train our eyes. Eye training is something that we don't really apply, but it's really important to train the muscles of our eye. And I really enjoy how to release the vagus nerve that gets so much tension. It's around our neck. And we do this by specific practice that I will show you on the 16-week program. If you are interested about this program, you simply have to go to my website, joafitness.com, and it's the program right on the page, and you can actually read about it. And if you are interested, you can send me an email. I can send you more information about, and you can just sign up into the program. You can get to practice 16 weeks of the exercising, and you will definitely see a progression. All the students, over 1,000 students, have done this program and they see results. I'm super, super excited, and it gives me the biggest reward, which is seeing those messages. You can go to my Google reviews and read those positive messages of the students that have completed the program successfully. They have been able to learn about body awareness, posture awareness, working on the anti-inflammatory nutrition, where they actually get to reduce inflammation in the body. And not only that, they're able to feel more confident and feel living be better as the way as they project themselves in the world. So today we have Dr. Khan. Dr. Khan is an expert in the musculoskeletal medicine. He is an expert on pain medicine and regenerative medicine, which is evolving so fast. He specializes in the intervention of orthopedics using orthobiologics with X-ray and ultrasound guidance to treat patients. He is not only a doctor, he's actually a scientist. He's constantly looking and making all these clinical studies to be able to bring the top edge technologies in Canada. He works in the University of Toronto, and he also works in the Institute of Human Mechanics, which is right on the core of downtown Toronto. Dr. Khan also teaches medical students and residents in the McMaster University. So I'm just excited to have Dr. Khan. He is, I would say, one of the best doctors reputable here in Toronto, and I'm extremely blessed to have him for the third time with us. We have been talking in the past about gut health and the spinal health. There is an relation between the gut and the spinal health, and this is something super interesting. So I welcome you to go 2 episodes before this one. You will be able to dive deep into this specific topic. The second topic was plasma, which is one regenerative medicine that is applied to support the body, and it's actually becoming very popular, not only to reduce the wrinkles and to regenerate the hair loss, but also for our spinal cord. And today we are going to be talking about stem cell therapy. So please get ready, get comfortable, and let's dive into this amazing conversation. Thank you. Hello, my friends. Happy Friday. Back into Alignment is here for you to help you to find solutions for your back pain and your inflammatory conditions. It could be reflected in so many ways, especially in the back. That's when we realize when we are having some type of trouble. And yes, we are here every Friday giving you information related to the latest technologies and therapies that can be accessible to you. We are so excited to have this month of December, Dr. Adil Khan. He's here in Toronto, and we are both supporting our community, bringing support for those experiencing pain. So yes, my name is Joa Rivas, and I am a yoga and Pilates teacher from 2010. Beyond that, I'm a teacher and facilitator of wellness solutions, especially for those that are experiencing discomfort. So I wanted to introduce you to this podcast for you to be part of a community, to engage together, and to actually be able to drive into solutions. So today, Dr. Khan is going to be going in a deep conversation about stem cell therapy. So get comfortable to listen to this very interesting approach for regenerative medicine. So hello, Dr. Kang. How are you today?
Great. Yeah, no, I'm excited to talk about it.
Yes, we had Dr. Kang on the last 2 episodes. We chatted at the beginning from the most important level of solutions, which is actually the gut health. And we got into conversations related to the spine, which we never really connect the gut health and the spinal health. And it was really interesting how he dived deep into peptides and into solutions that have helped conditions related to the spine and related to the mood. And almost, as you know, the second brain can affect the entire body. In the second talk, we actually dive into PRP, the platelet-rich plasma, which we have heard before, especially if you have done some type of beauty treatments where we find solutions becoming younger by having injected in our body our own blood that is centrifugated, and also being able to bring youth in our skin. But now we're going even deeper treatments, like for the spine, and with specific doctors like Dr. Khan. He actually has this specialty to support people that have sport injuries and applying these latest technologies. And I actually have a question that one of our listeners sent me. I have many questions, but this one in particular I wanted to address because there is a lot of misconception in plasma. And this person is Betty Borat. She is in very close here in Toronto, and she said, I was interested to try someone to tell me that the PRP at a certain age is no benefit. There is no benefit at a certain age. All platelets or something like this. I'm confused if I should do PRP or now I'm too old for PRP.
Yeah, so she is right in that your plasma effectiveness does decrease as you age. So if you think about it, what we're doing with the plasma is we're taking your blood, we're centrifuging it, and we're concentrating the platelets, right? And so the platelets are molecules that help with healing. They increase growth factors, they reduce inflammation, but the capacity of the platelets to work and regenerate tissue is dependent on the host. So obviously, if the host is unhealthy and if they're very elderly, the platelets will not have as many growth factors or anti-inflammatory messengers. And this has been shown in a few studies as well, and we've seen it clinically as well. So it's not that it can't work at all, but it may not be as effective, which is why, generally speaking, if I have someone who's more elderly, I would prefer to use what's called allogeneic stem cells, which is off-the-shelf stem cells or donated from someone. So like you can use fat stem cells from donation, like that are from someone else, or you can use umbilical cord stem cells that are from someone else. And those are obviously from young, healthy people, or they're from a newborn, and they haven't had a chance to have any mutations or any issues. And so those can be quite powerful. That's why the future of regenerative medicine really seems to be allogeneic stem cells, and then also using gene editing in combination with that. So that's where the field is kind of headed now.
Okay, so the older we get, the less effective is the treatment. And now you also say that was the second question. If we can actually receive PRP from another source that is not actually our body.
Not PRP, because the plasma has certain antigens in there that can trigger your body to have a bad reaction. But stem cells, the way they, at least for the way we process them and everything, it's what's called, especially umbilical cord stem cells, they're what's called immunoprivileged. So they don't trigger an immune response. So that means they're safe to take. So you can use stem cells from other people, but you can't use PRP from other people.
Okay, that's good to know. So I hope this helped you, Betty. And I'm excited now to dive deep into stem cell therapy. Stem cell therapy has been out there with Dave Asprey. I believe Dave Asprey talk a lot about stem cell therapy. I hear about Tony Robbins about talking about stem cell therapy. And of course, Joe Rogan, he's been applying stem cell therapy. And many of these celebrity actors, they are using these techniques to rejuvenate their bodies. And of course,
that's why I'm so busy. That's why I'm so busy.
Yes, great. But the most important that you were doing now is trying to make it a little bit more accessible to everyone, not only to the celebrities, but also to anyone that is experiencing some type of dysfunction. So let's just go into the basics, learning about what is stem cell therapy, how long has been out there, and how long has been here in Canada.
So stem cells were allowed about disallowed, I would say 3 or 4 years ago, meaning Health Canada basically created regulation around it. So not just anyone can do stem cells. So myself and Dr. Carmi, so he's at the Carmi Clinic, he got approval for the stem cells in about July of this year, July or August. And so we started doing stem cells in Canada just recently, and because we got approval to do it. So we're allowed to do it under Health Canada approval, and we're doing it for osteoarthritis specifically. And so it's an open trial, so people can still enroll into it and contact us if they need to. But we're in the process of applying for additional studies right now for umbilical cord stem cells, and then also what's called exosomes. Think of exosomes like the soup or the broth in like a chicken soup. So I think we might have talked about this before, but it's basically the broth, and you leave the chicken in there, and you get all the nutrients, and those are the exosomes. And we isolate those, and you can put them systemically, intravenously, and they can help with inflammation and pain, and it's anti-aging and longevity. So a lot of people like it just for recovery and longevity purposes.
Mm-hmm. And one of your posts from Instagram, you are commenting that stem cell therapy, the ones that are applying this moment, have a precise function. So in this case, you are working with osteoarthritis, but the ideal is to work in a stem cell that is actually being able to serve other functions. That's what you're trying to do?
Yeah, exactly. So just so people understand, there's two main types of stem cells. There's adult stem cells, and then there's what's called fetal or perinatal stem cells. So adult stem cells are where we take them from an adult, obviously, and those are usually fat or bone marrow stem cells. And you can isolate those, and you can do what's called expand those, which means you can grow them and increase the cell count so that can regenerate more tissue. Fetal or perinatal stem cells are basically amniotic fluid or amniotic stem cells, placenta, umbilical cord blood, or umbilical cord tissue. So there's different types of stem cells that you can get from the perinatal tissue. And so those stem cells are more true stem cells because they have the ability to turn into any type of tissue, whereas adult stem cells are technically not stem cells. They're what's called committed progenitor cells, which means they have a certain cell lineage they're going to go down. And even umbilical cord stem cells, the technical word is what's called mesenchymal stem cells or mesenchymal stromal cells, because even those can't turn into anything. They have certain things they can turn into. The only true stem cell is what's called an embryonic stem cell, where you take it from an embryo. But that's obviously controversial. So you don't do that. Just create embryos to take their stem cells. But there's new technology being worked on what's called induced pluripotent stem cells, or iPSC, which is where you can take a muscle, or I could take any tissue in your body, and I could use genetic reprogramming to turn it into an undifferentiated state, meaning it can make it into a naked stem cell, and then that can turn into any type of tissue. So it's called iPSC cells, and that's really like a really exciting area of research. They're using that for Alzheimer's, like Parkinson's, all sorts of things. But there's exciting, and that's the thing about stem cells now too, is being used for 80 different conditions. It's not just for a few things anymore. And the word stem cell, like, it's not a great term because it's so broad and encompassing, and there's different types of stem cells. And most people, when they think of stem cell injections, they're actually talking about progenitor cells, meaning they're adult derived and they can reduce inflammation, but they're not going to really regrow new tissue. To regrow new tissue, you need to, generally speaking, you need to expand the stem cells, or you need a scaffold, and then you need lots of growth factors. So it's a bit more complicated. So that's why I think there's a lot of misinformation and marketing out there. And usually there's doctors who don't really work with scientists, and they're just, they're trying to market, and of course, and just, that kind of stuff.
Yes, exactly. For people to know, you're not only working on the application, you're doing a lot of researches for the University of Toronto. That's why you are traveling to places that are a little bit more advanced in their studies, to compare and to perhaps bring study cases in Canada, so they can actually start approving this type of different approaches that you were commenting, that it seems like it's a lot of a specialty of the specialty. So
exactly.
Exactly. Yeah. And you were commenting that the stem therapies that you are applying in this moment are reflecting anti-inflammatory responses, but you can see that is on a spectrum that is really hard to really work in this moment. You're just trying to amplify this potential. That's why you're traveling overseas, which is really great to have that approach. I'm excited to hear what's happening by next summer when you come back with all this education from Dubai, Italy, Mexico. You are here in Toronto in the Institute of Human Mechanics, and from your practice on this year, the very first year applying stem cell therapy, I wanted to know if you ever have treated someone with cancer, which is one of the diseases that we're still trying to find the solution, the cure.
I have not, but there is something called CAR T therapy, CAR-T, and that's actually a stem cell or cell therapy that's been used to cure cancer or put it in remission. So it's actually approved in Canada now, and in the States as well, for certain types of blood cancers. But basically what it is, they take what's called a T cell, which is like a type of cell in your body that regulates your immune system, and they use gene editing to program it to kill cancer cells. So it's really cool. So it's called CAR T therapy, and it's being used for lupus as well now. But that's what I see being the future of cancer treatment, is CAR T essentially, and different types of cell therapy that are going to actually target the specific pathways. Because right now, chemo, radiation, surgery, all that stuff is very broad, and it can have a lot of side effects. So this is much more targeted and precise. And that's the way medicine's headed, right? It's becoming precision medicine, and it's becoming much more localized and targeted with specific pathways that we want to modify.
Exactly. What about the consequence of having COVID? Do you have any practice with stem cell therapy? And
yes, that we do actually, because we have two products that we're using for long COVID. One is what's called purified amniotic fluid, or exosomes. So we're actually applying for a study right now with Health Canada, and hopefully we'll have that approved by the time I come back. But basically, you go IV, where you take the exosomes that derive from amniotic fluid, and then you put them systemically, and it can help with long COVID, because long COVID, a lot of it is chronic inflammation, and this helps to get rid of the inflammation. Now, and then the other option, which is more potent than that, is IV stem cells, where you're actually taking the whole cell and putting it through your whole body. And that's being used for some people who may not respond to those treatments, or who have more severe symptoms, or have like autoimmune conditions, because it's almost like a stem cell transplant. You're replacing your body stem cells with another person's stem cells.
And now that you're going to Mexico, are they actually doing in Mexico this type of treatments with cancer?
They have protocols for cancer, and they have protocols for all sorts of things, but they don't have the CAR T specifically. I don't think they do, but this CAR T right now I think that's the best, at least as far as I know, that's probably the best stem cell cancer treatment. But it's very specific, and it has to be in clinical trials. But now like I said, they're using it for some blood cancers, and I think it's a matter of time before they start using it for other cancers.
And in the regenerative medicine, what have you seen that has been giving the best results for any type of mental health issues? We're talking about clinical depression or anxiety or some type
Yeah.
of
So
mental
there's
neurological
yeah,
issue?
there's two things in regenerative medicine that can help with that. One is the IV treatments, because the IV treatments cross the blood-brain barrier. And what happens in your brain is that you get what's called neuroinflammation. And that's a big part of why people have mental health issues. And so that neuroinflammation, you can use nutrition, exercise, diet, all that stuff, but sometimes it just doesn't get better. And so to put out the fire in your brain, the IV exosomes or IV stem cells can cross the blood-brain barrier and help to put out that fire. And now the other thing that we can do too is we can inject exosomes into what's called the stellate ganglion. The stellate ganglion connects with your vagus nerve, and it connects with your autonomic nervous system. So it basically helps for people who have severe anxiety or PTSD. It can help with that, and so it can help with resetting your whole nervous system, so to speak. And so I've had, I've done it myself, but I've also seen other doctors, and there've been a few published case reports on it. It's really it's amazing to see how people's whole nervous system calm down.
Mm-hmm. We were talking, for those people that are not watching the video, the application around the neck, which is where our vagus nerves flow from the base of our skull down towards our gut, and that actually will regulate the parasympathetic and make us more calm and relaxed. So that's actually really interesting. I never heard about the application of the stem cell therapy for the vagus nerve. And because I do have many of my clients and friends that actually have kids that are autists, any type of practice that you have actually
Yeah,
applied on
yeah,
autism?
there is a specific protocol at the clinic I'm working at in Mexico that has a protocol for autism. And clinically, I can tell you, people who've gone through it, like usually their symptoms improve, like they're able to be more aware, they concentrate better. Sometimes their motor symptoms, if they have those get better. So it's pretty amazing, because I think again with autism, we don't fully understand it, but there's definitely like a gut brain access, and there's inflammation and that component to it. And I think helping to almost reset the immune system and helping with inflammation is probably the reason why it helps autism too.
Mm-hmm.
But
Okay.
yeah, it's usually the IV stem cells, and there's a protocol they have for it. We have for it in Mexico. Yeah.
Coming back into alignment, like this podcast, why don't we just come back into the stem cell therapy and the application for our spinal cord, like healing the most typical issues in the spine, like scoliosis, perhaps sciatica, or any type of nerve issue happening and affecting our spine. Exactly, any type of uh, experience that you can actually share with us.
So yeah, for the spine, I mean, that's one of the things I specialize in, because I treat it all the time. Is yeah, there's different options, but generally speaking, if you have a lot of degenerative disc disease, or you have arthritis in the back, the stem cells can be phenomenal for that, like IV, but also injections. And there's a recent study out of Mayo Clinic, which is obviously a great institute, and they use expanded stem cells, like adult stem cells, and in degenerative disc disease. So people whose discs like wear out and they shrink as they age, or they get lots of inflammation and pain. And all the patients in the trial got better. So it's pretty amazing to see with that. You can also use the plasma injections too. The success rate for that tends not to be as high, but it's like 70-80%, but it still does work. And it is a cheaper option, but the stem cells tend to have a higher success rate. So it's pretty amazing for chronic pain and spine issues. And, even if you have like, some sort of spinal cord, like inflammation around the nerves, or damage, it can help. The IV stem cells can potentially help with that too. So people are using it for all sorts of stuff. They're using it for ALS now and multiple sclerosis. But again, it's different protocols. So like, you have to really go to a physician who has experience, and is also, I think, involved in the science. Because if you're not involved in the science of regenerative medicine, then you're not really going to understand what you're doing, to be honest. And most doctors don't really understand what they're doing. They're just doing it, but they're not doing science research or anything, so they don't really fully understand how stem cells work and what they're really trying to do.
Mm-hmm. Yes, as we listen to you, we understand that regenerative medicine requires constant education and practice and learning, because it's technology, right? Technology just keeps moving and keeps evolving, so we need to catch up. So yeah, we understand why you're traveling so much.
Yeah.
And now, like, let's say this is probably one question that everybody's asking, because we have a continuation talk every week. We talk about PRP, plasma, and now we're talking about a stem cell therapy. How could you differentiate one of the other? Is it one better than the other, or like they both have different function?
Yeah, I would say PRP is great for muscle tendon issues, like muscle tendon tears and stuff like that. It works pretty much 100% of the time. But when it comes to degenerative conditions like osteoarthritis, like chronic nerve pain, then definitely the stem cells are better. And then obviously plasma can only be used for like a few orthopedic conditions, whereas stem cells, because they're so broad encompassing, they can be used for, like I said, over 80 conditions. So, and there's different applications for those. So I think PRP is a more limited window, but for people with sports injuries, PRP like often is all they need. But for some people who have more chronic pain and fibromyalgia, chronic inflammation, stuff like that, then usually stem cells are a better option.
Mm-hmm, mm-hmm. Of course, again, let's just talk about reality. Let's check our calculation about how much is the cost of a stem cell therapy right now in 2022, moving to 2023, and where do you see the prices going for the next 5 years from now?
Yeah, so right now it's about, depends where you go, but in Canada for our clinical trial, even though it's approved by Health Canada, we still charging patients. So but it's around 6,000 Canadian to travel to Mexico or Dubai or something and get stem cells done. It ranges from like 7,000 US up to 20,000 US if you're doing like the full stem cell IV for like autoimmune conditions and stuff like that. So obviously it's expensive, but the cell manufacturing, which means the cost to make those cells and expand them, is going to come down. So I imagine by 5 years, I would think it would probably be closer, like probably like a 30% reduction. So I could see it being like, like 3,000 to 4,000 for an injection, and then like maybe 15,000 instead of 20,000 for like the IV type of thing.
Okay. Yes. Okay. Did you guys hear that? So it's about 6,000 in Canada, and we're talking about a specific condition that Dr. Khan will treat with your body. Now, tell us about the outcome, which is the most important. Sometimes we are putting our money in the wrong basket. So yes, you may be giving the money to your chiropractor, and if you calculate $200 a session, and you calculate this 2 times a month perhaps, and it's for 100, and now it's like a 5,000 a year, and it's not really a lasting result. It's just a temporary result, so it's not that bad if you actually put the investment into the outcome. So tell us a little bit about how have you seen the people adapting to stem cell therapy in terms of the solution. Is it like a lasting for how long?
Yeah, so it depends. So if you're using regular stem cells, which we have in Canada, usually that lasts like 3 to 4 years. If you're using the expanded stem cells where you actually grow them, like Mexico or Dubai, that's generally long. That's like 10 years or longer. Like it's usually a long-lasting solution. So it's not something you need done like all the time. So I think it depends what your goal is, but expanded stem cells are like where you grow them and you have a high cell count. That definitely leads to long-term results, like at least like usually like a decade or longer.
Mm-hmm. Okay, that's promising if you actually can.
So if you do the math, if you do the math, right, it's if you're someone in chronic pain, and yes, you go to physio or you go to chiro, and I've seen this many times. Like people spend years going to chiro, physio just to maintain, and then until we do the treatments, and then once we do the treatments, they spend more money up front, but then they don't have to go back to chiro, physio for all the time. They can just maintain with exercise on their own.
Exactly. Let's just imagine a story. This lady, she has osteoarthritis, herniated disc. She has a lot of pain. Her name is Joa. And she gets her stem cell therapy. Do you recommend her to exercise after stem cell therapy?
Of course,
What is normally the adaptation in the body? Or just simply you inject it, it's like you're healed. Just wait for the
no, it takes time. It takes time, and adapt. Like you said, it's very important how you adapt the tissue, and so tissue adaptation as you get less pain is very important. So that's where having a good program, and usually we make most people after stem cell treatments, like they'll usually do like rest for 2 weeks with minimal activity, and then usually get you on a progressive exercise program to help strengthen and stabilize everything. Because as your pain becomes less, then you want to be able to strengthen everything to support the structures around there. And that's the way you get long-term results. You can't have structure without function. You know what I mean? Like they always have to go hand in hand. So it's so important to do the functional stuff and everything.
Okay. So you suggest the person, okay, you got your injection, but now it's time to stimulate your muscle growth and to get a proper nutrition. And the rest is just regeneration. It takes about 6 months to regenerate that area injected?
For regeneration, it could take up to a year, I would say. But in terms of pain relief and everything, most people feel it within 2 months, 1 to 2 months, and then it gradually keeps improving from there. But some people are lucky. Like I've had some people, a month later, they're like pain free and they feel great.
Okay, yeah, that's very exciting. Now we know, as we are now about to finish our conversation, that you are you really love video games, and you also love fitness. I know you do a lot of bodybuilding style, and also to maintain your physique, maintain your mental health. We wanted to know, like, what is a regular routine or a regular day for Dr. Ken? I know you are working, you're studying, you're making clinical trials. You have two girls, you're a father, so you're really busy. How is a day of Dr. Ken?
Oh yes, it's crazy. So yeah, most days I'm up at like 7 and to take care of the kids, drop them to school, and then off to work. And usually I have a lot of business meetings these days because I have a few companies as well, like startup companies, and I have a new company, a regenerative medicine company, and I do consulting as well. So those are throughout the day. And then yeah, usually I try to go to gym after work, which is usually by 6, and try to go get in a workout and put my kids to bed. And then usually at nighttime, I'm doing research, or I'm catching up on stuff. And yeah, and then I feel I basically don't waste any time. And I spend time with my wife and stuff, obviously at nighttime too. But like, I always say, skillful management of time and attention is probably the most important determinant of success. And a lot of people don't realize that what they're intaking too. So I don't try to intake any, like I make content, but I don't really consume content. And like, unless it's like, obviously journals or articles or scientists I respect and stuff like that. But I'm not really on TikTok or on YouTube just watching videos like a lot of people do. So that's I think one of the key tips I would say for success. And then yeah, I used to love video games, but now I don't have time anymore. But I was a former world champion in Halo, so which is a funny story, but it translated well because our job is very technical and it involves using your hands, and it's all high hand coordination. So all those years of video games paid off.
Nice, yeah. Crafting with purpose is your best way to connect so many of these activities. And I know you have a purpose. You're really clear what you are doing, especially in a technology that is growing so fast. You're probably inspired by so many other doctors that are in the same kind of frequency, in the same energy field that you are vibrating in this moment. So I'm very excited to hear the discoveries that you're going to get from these trips. And we will have only one more talk before we just welcome 2023. We're so close to 2023. So thank you so much, Dr. Khan. You have shared very important information. And for you guys, thank you for listening to the podcast. If you have any questions, please send us the questions. As you see, Dr. Khan answers the questions right away to you. And we learn this way. It's a mutual reciprocity that we get to learn from each other. So thank you so much. And remember that together we are stronger. Thank you. I hope you really enjoy this talk with Dr. Ken. It was so fascinating to see how the stem cell therapy is growing so fast in Canada, and we cannot wait to see the discoveries of Dr. Ken and the evolution of medicine. As we are heading into a new year, 2023, we welcome you to join our 30 days of hip healing exercises. If you are interested to learn how to mobilize your hips and to reduce your lower back pain, I welcome you to the 30 days practice, which will only involve about 5 to 10 minutes of stretches every day. That's the only commitment that we are asking you to do, is to commit for about 10 or 5 minutes a day. So what you do is you sign up into this app. You will have an app, you will have videos. I am going to be instructing you about how to stretch your spine, how to stretch your hip, and how to release any pressure around your lower back, especially for those that are sitting for long hours. I know this program, it will benefit you. It's about 30 days, which is great to create a habit. Remember, life is the results of the habits that we actually take. So I welcome you to the 30 days hip healing for the 2023. So please go to my website and check out this offer that is for the month of January. And I am so excited and so blessed to be able to have Dr. Ken in our channel for this month. I wanted to wish you a beautiful evening, a beautiful day, depending on what time you're listening to this, and excited for a new week and also the Christmas that is very soon coming, the holidays, or any type of celebration that you do in December, we are encouraging you to get connected to your family, to your friends. Just take a break from work and remember that having balance in life is essential. So let's just get ready for the day, or if you're ready to sleep, remember that here we are every week, and let's meet next week again. Thank you so much. Remember that together we are stronger.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.